Welcome everybody to our local professional and local hero series. And today I am so excited to be interviewing Sunny Kim. So I actually met Sunny through our kids' school and I saw her around, especially I saw how she interacts with children and I was so amazed. And later when I found out what she does, so I thought I would definitely have to invite her here so that I can ask her more questions. So welcome, Sunny.
Thank you for inviting me, Helen.
Of course.
That's weird.
Well,
Uh-huh.
do you mind to tell everybody what do you do? What is your profession?
Hi, my name is Sunny Kim, and I am a nurse practitioner. And I've been a nurse practitioner for the last 6 years or so. And I'm very excited to talk about our profession today.
Yeah, I feel like, the nurse practitioner, a lot of times they were not being mentioned. We talked a lot about nurses, we talked a lot about doctors. So how did you end up being a nurse practitioner?
So I am very grateful that I have become a nurse practitioner, but actually I received my first bachelor's degree in music in UC Berkeley, where I specialized in music, piano accompaniment.
Yeah.
I was interested in so many things. I went in as a psych major, but I was minoring in music, but my music professor told me, hey, you got to come to music because we need more accompanists. And that's how I ended up becoming a music professional, professions. I still play keyboard with a church band and accompany local choir or accompanying like instrumentalists or soloists as singers as needed. And I
As a
always
matter of
believe
fact,
my function. Yeah,
as a matter of fact,
yeah.
I noticed that your music talent when we were doing one of the volunteering work at school, and then you demonstrated to us what kind of music you would share with the kids, and I was like, oh my gosh, I cannot do that. I was
Oh,
like, wow, she's so
yeah.
talented.
I don't. Whenever I do little stuff with kids, I always want to bring some musical stuff into them. So I was like, sometimes I make music for the kids to, read to kids at the same time. So it's always amazing how music can be the universal language to communicate. So I
Totally.
really appreciate about that too. Yeah, and I always believe my function as a piano accompanist was bring out the best in the other performers. And
Mhm.
in similar manner, I think the healthcare providers are the same. We want to provide and we want to support other medical
Mhm.
professionals or other members of community. And I actually wanted to become a doctor,
Mhm.
but I failed to go into the medical school. And after waiting in that waiting list for so long, I already missed the next opportunity to apply. And I found out there's great opportunity to become a healthcare provider as a nurse practitioner,
Yeah.
because nurse practitioners also do family medicine. And currently there are so many nurse practitioners working different areas in the hospitals or outpatient clinics, but still 90% of the nurse practitioners are working in primary care. And that's what I wanted to do. I wanted to
Mhm.
see patients in primary care
That's
as their
awesome.
friend. Yeah, that's how I became a nurse practitioner.
It sounds like you are just a giver and you just love to help people whatever way you can through music or through healthcare. But I know that a lot of people, including myself, have some kind of like not really misconception, but we just don't really understand what is a nurse practitioner. Are they doctors? Are they a nurse? Or in between? Do you mind to
Mm-hmm.
like maybe explain a little bit about who they are?
Nurse practitioners are your partners in health. And we provide healthcare services to patients of all ages. We
Mhm.
evaluate, diagnose, and treat patients their acute and chronic illnesses. And we order and interpret their diagnostic tests and prescribe therapies and medications. And we do it in all 50 states. And
Mhm.
there are different specialties in NP, but nearly, as I said earlier, 90% of NPs are certified in the area of primary care. And just in California, there are more than 26,000 NPs. And
Wow.
in the nationwide, there are more than 290,000 NPs around. And currently, 27 states in the United States permits all nurse practitioners to practice fully without any restrictions. But some states like California, and we have some restricted practice where we are required some levels of supervision by physicians. And I personally don't mind that, and I really enjoy collaboration with other physicians, because I think all our healthcare providers should be like that.
Mm,
We have to work together with a collaboration setting, and you cannot know all in their
yeah.
specialties. So we've been always working in different specialties all the time together, and I think we are working safely within our scope of practice, and I think we love our patients. So I
Yeah.
think it's a great profession to have and also to see.
So you have your own patients that you actually see and seeing you as their primary care healthcare provider. So,
So
right.
that depends on the clinic setting. In
Mm,
some clinics, they allow nurse practitioners to be a primary care doc, primary care providers, but
mhm,
some setting, they want you to work together with the physicians.
got it.
So I don't know about, but I've never been in primary care yet. My first job was a chronic pain clinic.
Mm,
So I was seeing a lot of chronic pain patients who sustain injuries through their work or other places where they sustained their back or their joints. So I took care of them for about a little bit more than 2 years. And after that, and for the last 3.5 years, I worked as a preoperative nurse practitioner in a local community hospital nearby in a anesthesia department.
yeah. So I
Mhm.
know that you actually had stopped working and then you're going to be starting off your new job in a few months, but you were kind of still working during this COVID season. How was it to be working as a nurse practitioner during this
Mhm.
pandemic?
Right. And nurse practitioners were very frontline workers. And I heard over 60% of the COVID related work, like testing and taking care of COVID, they were advanced practice practitioners, like advanced
Mm,
practitioners such as PAs and NPs in this area. As a preoperative nurse practitioners, we had to prepare for this COVID. There were times that we couldn't do any elective surgeries for a few months when um, because we had to prepare for that surge to come in.
mm,
And after that, when that was over, we had to make sure that patient who comes to the hospital doesn't have COVID, and making sure that we keep our environment safe for the workers and for the patients and for their families too. So COVID changed everything in our hospital, everywhere. I bet we had to reduce staffing. We had to just dealt with a lot of different things. We were testing patients. I personally was in the full gown testing 40, 50 patients a day while doing the preoperative care, while ordering and so we were working very hard during that COVID era. And I bet other places were the same.
yeah,
Mhm.
I mean, we've
Similar.
seen obviously on the news and everywhere how hard the medical professionals been working during this COVID pandemic. And not only that, you have children at home and you have elderly parents, obviously. I don't know if they're living with you, but you probably want to
Mm-hmm.
see them. So how did that affect your personal life?
Yeah, so my father is in a nursing home, skilled nursing facility right now.
Mm,
He has mild dementia and he has end of kidney failure, and they just completely closed their doors for their visitors. So we couldn't see him for over 3 months. And then luckily around July, they just let me and my mom go to his dialysis center. So with the full gown, with safety measures in place, we were able to visit him once or twice a week. So that was just my personal experience. And also seeing in the hospital, there are a lot of families, who until the patients are in the deathbed, sometimes they cannot see their loved ones who's going in for surgery or who's in the ICU. It's really difficult times for a lot of patients, I believe, because of COVID. And
yeah.
yeah,
I cannot even imagine. I mean, how's your father doing then during that time, especially when he couldn't see you guys?
he probably thought we kind of deserted him, not seeing him. So
Yeah.
I felt so bad. But when we came back to see him, I guess the nurses kind of explained to him, and his dementia is not getting any better. It's actually getting worse. And it's actually getting worse than normally because there's no connections. But we
Mm,
are trying our best to communicate through are like, like virtually through FaceTime that their nurses are taking care. But I think it's just hard time for all.
Yeah. And I mean, speaking of which, is that I know you also do some volunteering work to help raise awareness of this Alzheimer's because of your dad's situation. Can you tell us a little bit about that?
So it was just it was a volunteer, it wasn't really a volunteering, it was a event that Alzheimer Association put out there. It's actually yearly event that we do, and I'm a marketing board member, marketing chair for our Nurse Practitioner Association for California in Silicon Valley division. And we are involved in this event, but this year we just couldn't. So we had to make our website through our virtually. And I just wanted to put some personal note into that experience or event that I had to involve because of what I did of my other volunteering. But it was a great experience that I had. That it's just, when you're volunteering, you just get to know different areas in this community, what other people are going through. Yeah. And I always thought, like I was always interested in cardiology, cardiac patients or cardiology, but those are something that we can change, we can cure. But Alzheimer or back pain or pain, like chronic pain in general, it's something that you have to live permanently. But there's something that we can do. And if we can put some resources into that research, I think we can end Alzheimer's disease. And I bet we can do more, we can find more interventions with chronic pain, but a lot of things that's happening in the United States are very connected with money. What intervention is going to make money? So I don't know. I have a lot of questions about that, but I hope at least we can increase our awareness about other diseases or illnesses or something else, a lot of things that's happening out there. Yeah. So during this time that I wasn't working, it was nice experience that I was able to involve in different things around.
Oh, that's great. I mean, in a sense that I always think some of our misfortune, like your father experienced that dementia, Alzheimer's. This is like a calling also for you to raise awareness to help other people. So just like I know a lot of other families, maybe they have some other diseases, right, in their family. That's like a personal experience where you really feel very strongly about. But it is important to have that emotion connected to it so that you can actually speak about it and tell people about it. It is very hard for families who have to go through that with their loved ones suffering this.
Oh, definitely. And caregiver burden. It's amazing, but we just don't know. And this country is not really prepared for anything like that in the long-term care. Like people who have lots of money or people who doesn't have a lot of money, maybe it's okay. But for normal people, in that range, it's just so hard. It will be hard, and it will become harder in the future.
Yeah, you touched on a really good point. A lot of middle class people, they are kind of stuck because it is very expensive to have long-term care for your elderly parents. So if you're not prepared ahead of time, it can be pretty detrimental to you or to anyone with this financial burden. I mean, do you have any advice or any recommendation on that?
I don't know. I came from Korea, so I was raised and grew up in Korea. We have universal health care, and I feel like our country respects elders more, maybe because of the culture. And we, as a worker, we can have our parents be in our insurance. So it's because we're the one who's making money, and we can try to provide that insurance for our parents. So I think that was a great way, because here it's only you and your children. So if you're not prepared, then there's no way. I know my parents were not prepared, and they were immigrants, but ultimately it's kind of us who needs to, our working age, who has to take care of those ultimately with our tax money anyway. So I think there should be a better way, but I just feel like it's not just that problem, but there are just so many other problems that with our current healthcare system.
Yeah,
I mean,
absolutely.
we spent 18% of GDP. That was 2017. We probably spend more than that right now, but and that's like double the amount that other developed countries are spending, and we still have problems.
Yeah.
My colleague, a nurse practitioner who works in Kentucky, she she regularly volunteers in free clinic, and she went to this rural area at around like 8 o'clock in the morning, and she saw 200 people lining up for this care. And some told her that they were waiting since 2 a.m. so that they can get first in line, so that they can get the prescription with lower cost. They could get some care, primary care, and we're talking about one of the richest nation in the world
Yeah.
needing the medical mission in our country.
Yeah.
And there are, I think I told you right before this interview that I read more than 80 million of Americans live in shortage of primary care area. And this means there are 3,500 patients per single care primary care providers. Can
Jeez.
you imagine?
Yeah.
That means this lack of access means lack of, like immunization, basic care, you know, and it's really sad because working in the hospital, I've seen patients coming in with something that could have been prevented.
Yeah.
If we just treated that little infection, he did not have to cut his foot. He did not have to lose his leg. Or if he just treated his diabetes or hypertension well, he did not need that, he would not have needed that emergent open heart surgery. Or, there are just so many things that we can do better with
Yeah,
our
well,
healthcare
that is
system. Yeah.
definitely could have been
Mhm.
another topic that we can talk for an hour at least, because
Mhm.
it just seems like our country, no matter what, I know they were trying, the politicians obviously have been proposing a lot of different regulations, different proposal, but it
Mhm.
just seems like we're not there. There are some other countries that are definitely doing better than us. So yeah, no matter what, I just feel like I have so much respect for you as a medical professional and also as a mom. I mean, speaking of which, like you have your own children that you have to take care of, and you work long hours at times. So how do you balance work life situation?
I am not the person to ask, I feel like, but I'll do better. I'm getting better. But, as Helen, I see you working 24/7, I see that you have love for your job. And I was like that, and that was the reason I was so burnt out,
Mhm.
this year. So I resigned from my recent job around July.
Mm.
And that's because I loved patient care so much. I did not care for my own personal life. I did not care for my own health. So I felt so good and I felt useful when all my preoperative patients or postoperative patients had my number to call 24/7. And they call me, they text me because they don't want to contact their surgeons who would be so busy, right? And I feel like as a nurse practitioner, we feel a little bit more connected to our patients because we were a nurse and we treat them as our friends. And we so I had really good relationship with our patients, and I wanted to make sure that everybody gets good care from
Mhm.
our hospital, and and but it was hard during COVID era. So
Yeah.
I was working like 12, 14 hours a day, 5, 6 days a week, and I just did not have any enough time. But I think that's my fault. I could have done better, and people should do better, and they should take care of their family and their health more than anything. Um, and I will do so in my future job. But yeah, like during this time when I wasn't working, I was taking care of myself very well. So I'm very refreshed. I'm ready to go back to work, and I'll do, uh, you know,
Yeah.
I'll make sure. Yeah, I take care of my patients well as myself and my family.
I really share
Yeah.
that with you about like how we're so passionate about our work, but at the same time we have our
Mhm.
family to take care of. Sometimes we do have feeling guilty. And as a matter of fact, just yesterday I was just talking to my daughter, and as I was putting her to bed, I was like holding her, and I go, I felt like I haven't hugged you in a while. I haven't really seen you much, even though
Mm,
they're doing the virtual learning in the same house. But I was just so busy with work. I was in my office the entire time, and they were just doing their stuff. And then really after I finished my work, then we have that
mhm.
2 3 hours, maybe 2 hours. During dinner time, I'm preparing dinner, and then dinner time, then we hang out a little bit, and that's it. I was like, well, even though we're in the same household, we can still be, a little bit distance. But that's, I have to say, I mean, full-time working mom, it is obviously
Right.
it's difficult. But then at the same time, I do think that your kids probably really appreciate the fact that, wow, my mom is like out there really passionate about what she's doing. You're taking care of a lot of
Mhm.
your patients, so I'm sure your kids are really respecting that as well from you. Yeah.
Yeah, they were happy that I found a job. But
Yeah.
at the same time, they really loved the time with me that I did not
Mhm.
have. I never take a time off since, I don't know, in college, so I was always working, but it's amazing feeling. And I feel I was very privileged because I have a husband who works full time and who can take care of us. But not everyone in this time period who can do that. So I really want to use um, my skills in the future to serve those people who are underserved. And I am very grateful that I can do that with my
Oh,
profession.
you have such a
Yeah.
big heart. I want to ask you the final question is that if there's any kind of misconception about your profession, what would you like to tell people about it to share? It's like, no, this is not true. Is there something like one thing you feel like, oh, people always think, misunderstand my profession?
Uh, no, like nurses in the United States, we have good reputations, I feel. So most of the time it's really great. But, because I'm a nurse practitioner who prescribes, who does all these orderings and who tells them about their diagnosis, sometimes there are patients who say, hey, you're not my doctor. You don't have MD
Mm.
next to your name. So I'm not going to talk to you. So there, like, I only had maybe a couple incidents like that, but we don't work ourselves. All None of our health professionals work by themselves. We work together and we collaborate. And a lot, as a pre-op nurse practitioner working in anesthesia department, I worked with anesthesiologists, surgeons, and patient specialties like cardiologists, pulmonologists, their primary care, and we always collaborated together. My job was bringing the medical word to the surgical world. And, in order to do that, we just had to work all together and also during the post-op care with physical therapists, So in our health professions, we all work together. So I don't want people to think, they have less training, they're not as good as doctors, because we know what we're talking about. We have like nursing degree, and we have master's or doctorate degree afterwards, and we don't go out there not being prepared. So that's one of the misconceptions. And also, we have misconceptions from our medical professionals, like other physicians, who might think, oh, nurse practitioner, because I hear these, and so medical, those nurse practitioners or physician assistants are they're taking away our territory, and they don't even have that much trainings as we do. And yes, we don't have as much as training as we do, and that's why we work together with you. And there are, you cannot see them all. You are already seeing the shortage of physicians in this country, and by year 2030 there will be 122,000 physicians shortage in United
Wow.
States. And I think NPs can be the solution, one of the solutions to this.
Absolutely.
So, most of the time, if we can take care of our common problems in advance, then a lot of people can live their healthy lives. And it's about the checkups, regular checkups, regular monitoring your health. And I think we can do a good job in there. So I hope you don't feel, and we are nice people. So
Oh,
I hope when you
definitely.
see nurse practitioners, yeah, in your clinic, I wish we will be your partners in health.
Yeah.
Mm-hmm.
Oh gosh, I love what you just said. I
Mm-hmm.
mean, I mean, you guys definitely have a lot of big hearts. I feel like you guys are always thinking about giving, giving, and giving. And but then no matter what, there is still a lot of misconception about nurse practitioner. Just like what I told you earlier, I didn't really know much about that, but I feel like now
Mhm.
I definitely understand. Okay, although there is a difference, but the nurse practitioner, they are just as good as medical professional, I mean, doctors, because you guys actually collaborate and work together. So definitely, I love your stories, how much you do around the community with children and with, Alzheimer's community. And I know you're very active at church as well. So I want to thank you for talking to me and telling me so much about who you
Uh,
are in our community. So thank you so much. And I hope that we will get to see each other soon after this COVID, when our
yeah.
children are going back to school again.
Oh, definitely. We miss our play dates so much, but yeah.
All right. Well,
So you
take
take
care.
care too.
Yeah,
Thank
thank
you,
you.
Helen, for this opportunity.
Absolutely. Well, thank you everybody for watching. I hope like this is an opportunity for you guys to really learn more about what nurse practitioners are doing. And I think you guys will be really amazed how many heroes we have within our own community. And until next time, talk to you soon. Bye. Thank you so much for watching our YouTube channel. And don't forget to subscribe to our channel, like our videos, make some comments, because we're going to keep you posted on the most updated real estate news, housing market data, and also real estate tips and advice from all over the real estate industry. So thank you so much for watching, and I'll see you next time.